So, what about me? What about my journey? Why am I the clinician that I am? Well, you know, sometimes a lot of therapists say, no, you know, you must keep yourself completely separate. I often share quite a bit of my own story and my own journey with patients. And I've heard many times they say, no, that please, don't worry about that. It's really, really helpful to hear that little window into the fact that you get it. Yes, because, you know, I've sat in that chair. I have been in your shoes. So, you know, I think physician heal thyself and one's own experiences is a very, very important expression. So I had 7 operations under the age of 10, 11. I had, you know, ongoing health checks throughout my early years. I've had my own experiences. I've said in other videos about my mother's illness and her recovery from that. I later had a car accident when I was about 23, shoved from one side of the dual carriageway to the other, smashed up half the bones in my body, went through all of the emotional and physical pain and recovery of all of that. Then had, as you probably have heard elsewhere, issues with a pericarditis issue, and really that was the big thing to shift me into having to get to the roots of my own problem and looking at how all of those things have contributed to the chronic nature of my problems and this heart issue, which is now fully resolved. That took me on a journey of several years of psychotherapy, a spiritual journey in sort of martial arts and Zen and deep philosophical reflection. It's taken me into, at a time when really this understanding wasn't really out there, into the somatic world of the nervous system, of the energy, the craniosacral therapy, myofascial systems, looking for the answers, because great, Western medicine's fine, but if we stay in the box, we'll fix 80% of people. That's great. But then my passion has always been, yeah, okay, well, I'm not happy that we've got these 20% of people over here that aren't responding to treatment. Or the more and more I practice, the more and more you go, aha, actually I'm now more able to help those more complicated cases. Or I'm helping them, and I'm helping them at a much deeper level, because they don't come back 2 years later going, my back's gone again. Well, that's interesting. So my journey has been, and who I am, is really one of seeing the mind, the body, and dare I say spirit as important factors in our health. So what does that mean to you? You know, that's great. I don't want to just listen to me jabbering on about myself, but what about you? Because, you know, you're the patient. You're the client, you're the one that's looking at this video wanting some help. So what? Well, hopefully it means, you know, I'm not just talking the theory here. I've done the hard yards. Yeah, I haven't got your experience, I haven't. But I've spent many years, the last 20 years probably, of my clinical practice in this journey of understanding this complex creature that we are. And so, yes, I've sat in the chair, I've cried. Yes, I've done the hard work. Yes, I've got frustrated because I thought I was getting better. And now it feels as though I'm relapsing. I've done all that, yeah? And I've explored, and I know what it feels like to sit in that chair, yeah? And so, well, one, I can empathize with that difficulty, and the other is I think it's like you can watch someone driving a car, but until you've driven it yourself, it's not quite the same experience. And so I really think it helps you to be able to then work with somebody else. How could you teach someone to drive a car if you've never driven one yourself? Yeah, you can understand the theory, but oh boy, when you've really taken it to pieces and you've spent years understanding exactly what you do when you learn to drive, then maybe then you're qualified, I think, to help somebody else in the journey of learning how to drive. And so the fact that I've sat in that chair and I've spent 20 years of my life, of a 30+ year career, investigating this and doing the work on myself, taken myself to pieces many, many times, examined it, looked at it. And so, I'm not saying it has to be that heavy, but it does mean that because I've chosen to go on that journey myself, I'm well equipped to be able to support you and understand exactly what you're going through. on what can be a very difficult journey. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. Don't forget to hit the like and subscribe buttons.